going to talk about the skeletal anatomy relevant to the plantar fascia, which is a soft tissue structure. The plantar fascia inserts on the calcaneum and then fans out and has a medial band, middle band, and the lateral band. So essentially, it's a very large structure. Majority of the pathology related to the plantar fascia could be at the insertion or in the middle portion of the fascia. To scan for the plantar fascia, you will place the ultrasound probe in longitudinal orientation, looking for the calcaneum. Once you look at the calcaneum, you'll be able to see a bright structure which will be starting from the calcaneum, extending out deep to the plantar fascia. You'll also be able to see a muscle called quadratus plantae. You could inject the plantar fascia with an in-plane technique, bringing the needle from proximal to distal. Another way to inject the fascia would be, once you have located the fascia and a possible pathology in the fascia, you will turn the ultrasound probe horizontally and bringing the needle from medial to lateral or lateral to medial based on your patient positioning. Injecting the local anesthetic and steroid mixture or a PRP with the volume about 2 to 2.5 cc should suffice the plantar fascia injection. So I'm going to talk to you about the plantar fascia injection. This injection can be very painful, so it's always advisable if you do a tarsal tunnel injection or a vertebral nerve block, which will make the sole of the fascia sole of the foot go completely numb, and it will be much more comfortable for the patient to undergo the plantar fascia injection. As we know, the plantar fascia inserts on the calcaneum and has a band which is divided into intermediate, lateral, and the medial band. Usually the pathology is at the site of the insertion or the middle of the fascia. We can scan the fascia in the longitudinal aspect or in the transverse aspect. So we'll start with the longitudinal scanning, and I'll show you the fascia along with the calcaneum and the insertion. So here we have on this image the calcaneum and the plantar fascia with the insertion on the calcaneum, and this whole structure is the plantar fascia. If you have pathology, there will be hypoechoic area in the fascia, or it will be neovascularization. Once you found the pathology, you can turn the probe in the transverse position. So here now we look for the longitudinal view of the fascia, turning the probe and looking for the calcaneum with the overlying fascia, and then we can bring the needle in plane or an outer plane approach to go into the fascia. Here on this image, you can see the calcaneum along with the fascia. Either you can bring the needle in plane, go superficial, or you could go deep to the fascia. In general, if you're using the platelet-rich plasma treatment, you will do multiple dry needling in the fascia and will inject the platelet-rich plasma injection. I'll show you the needling of the fascia and how it's done. So you're holding the probe transverse and moving the needle in plane, in and out to do the dry needling. Followed by this, you will do a platelet-rich plasma injection. If you're doing a local anesthetic and steroid injection, it's advisable to inject deep to the fascia rather than superficial to the fascia. One of the ways that the local anesthetic and steroid injection works better for the plantar fascia because it thins out the fascia and the patients get significant pain relief in a shorter duration. Thank you.